Good evening, and welcome again to Public Perspective. I'm your host, Kevin McDermott. And at some point in your life, you will probably go through physical therapy. If you live long enough, you'll probably do it, or if you're my age, you've probably already been through it. So tonight we'll be talking a little bit about health, physical therapy, and a particular type of physical therapy, functional manual therapy. Our guest tonight is Dr. Jesudian Boddu. Dr. Boddu, welcome to the show.
Thank you, good to be here.
So let's start with a basic definition. You are a practitioner of functional manual therapy. So what is that, and how is that different from traditional physical therapy?
Functional manual therapy takes an integrated and a holistic approach on patient care. So it combines treatment of joints, soft tissues, as well as retraining the nervous system to bring a human being back to function, meaning back to walking, running, playing sports, playing with their grandkids.
So you mentioned the word integrated or integrative or holistic, and I hear those terms a lot in a lot of different contexts. So in this context, let's start with one. What is holistic about it?
So the holistic aspect is that it's not just limited to, let's say, joints, getting joints to move better, or just soft tissues, or just rote retraining of how to move. It combines.
And is that more traditional physical therapy would be more along that line, or is that?
Traditional physical therapy is effective, and it has its place. I think the functional approach is nice in that it brings together different aspects of physical therapy that don't always get combined together, and this produces a better result for patients who are lucky enough to experience it.
So I also hear the word integrated or integrative, usually meaning taking elements from different disciplines or even from different, Eastern medicine and Western medicine, and integrating them. A lot of cancer centers do that now. So is there something about that here as well? Are we drawing from different cultural medicines here to get this integrated kind of therapy?
There's a couple ways to look at it. One is the couple different disciplines in physical therapy. So everybody's familiar with treatment of, let's say, sports injuries. And that's an orthopedic perspective. And then there's the other aspect, which is a neurological type problem. So where, say, someone has stroke, Parkinson's. Those two avenues have slightly different approaches to patient care. And combining these two, which is really where things should be going, because no one is truly just a joint problem or a coordination problem. Usually these two go together. And so that is where the integrated aspect of functional manual therapy comes in. Another way to look at it is also where in the body something hurts. For example, someone could have had an ankle sprain. Pain goes away, and then 3 years later, 4 years later, they develop back pain. Something like this was actually brought up in the Washington Post recently about how people with ankle sprains kind of tend to develop other problems down the road, hip, knee, even back pain from a little ankle sprain a few years ago.
Now, how does that work? Why do they get that connection?
Well, just imagine having an ankle sprain. You don't want to walk like you used to walk, and eventually your leg doesn't work the way it used to work. And
you train yourself into new habits that are not necessarily good for you.
Exactly. Your body is amazing at learning, and it learns all kinds of things.
Whether you want it to or not.
Right.
Okay, so I would think that would be fairly common then, because if people get injured all the time, it's really easy. You can turn around the wrong way and twist something. So we're training ourselves to essentially circumvent normal healing patterns. So how do you approach that? How do you, especially if it's like last time I sprained my ankle was almost 30 years ago. Maybe that's affecting me now, but now I've had 30 years to learn something that's causing me injury. How would I undo that 30 years?
Well, first of all, our bodies are amazingly resilient. It's incredible what we put our bodies through, and they still take us around when we're 60, when we're 70, when we're 80. So you shouldn't have this impression that our bodies are fragile and destined to have injury. However, certain inefficiencies build up over time. Like I mentioned, sprained ankle, it could lead to hip tightness, which you may or may not notice, which could lead to back pain down the road, potentially. It doesn't have to. And so I think taking an approach that addresses the entire system, back pain, does the back move? What caused the back pain to start? Was it the hip? Was it the ankle? And so giving that global perspective really kind of enhances outcomes in the clinic.
Now, you also mentioned integrating neurologic kind of remedies here. So what would be an example of that? I mean, strokes clearly are a neurological thing.
Mm-hmm.
Is there a neurologic component to anything? Go back to the example of the ankle sprain. Is there something that simple that has a neurologic component?
Absolutely. We can break it down to something very simple. So let's think about just movement patterns. So when somebody has, let's say, a stroke, their movement patterns are significantly altered. So when we look at neurological impairments, they're a limitation in the way somebody can move because of some impairments through their nervous system. And you want to try to restore some of that, which could involve not just treating the nervous system aspect of our bodies, but also the mechanical, orthopedic. And a combination of them really brings the most out of patient care.
So what's an example of treating the neurologic angle of this?
Mm-hmm.
Even whether it's someone with a stroke or something simpler, how do you treat that? Because if nerves are damaged, it's very hard to regrow them, for example. So,
Absolutely.
So how do you treat that kind of nervous damage or nervous system damage?
Nerves do take a long time to regrow back. My approach is not to, functional manual is not intended to grow back nerves at a quicker pace. Mm-hmm. It's intended to retrain our bodies on how to move certain parts so that you can return to, let's say, drinking water with less pain or reaching for your jacket without having to guard yourself. Certain simple things like that. And that involves retraining certain patterns of movement in our body. And we're all born with certain patterns of movement. So you look at a little baby, you don't have to teach the baby how to crawl. The baby just learns to crawl.
Figures it out.
Figures it out. We have these built-in patterns within us, and using hands-on care and guided movements, we can tap those untapped movement patterns in our bodies, or in certain cases, limited movement patterns, and kind of bring them out to fruition. And this introduces free motion and free function back into the person.
So how do you assess what the issue is? You mentioned an example of someone who reaching for their coat might be difficult,
Mm-hmm.
and you want to teach them to do that with less pain. How do you know that's a problem in the first place? How do you assess that with a patient?
A simple way to know it's a problem is the patient comes to you and says, "Hey, I can't reach."
Okay.
And that usually takes care of knowing that they have a certain problem with something. The other thing is we go through an evaluation, which includes listening to someone's story, kind of figuring out their past history, what led them to where they are now, and then a hands-on clinical assessment, looking at how they move from head to toe, how they stand, how they sit, how they reach, and from there, honing in on certain areas that may be prime contributors to their impairments at this point.
So this would be kind of not just standing and sitting, range of motion. Can you move
Absolutely.
your arms, can you move your
Strength
legs?
checks, range of motion, how they get up, how they move from their bed to standing, general daily patterns of movement that you and I would use every day.
Rightly or wrongly.
Rightly
We use
or
them,
wrongly,
right.
yeah.
So if I were to come in
Mm-hmm.
and you want, the reason I'm asking this is about history.
Sure.
And how people's history leads them to where they are, going back to the ankle injury or any number of other things that might have happened. In my example, for 20, not quite 20 years ago, I was in a very bad rollover car accident. Walked away uninjured. Well, actually, I shouldn't say I walked away. They did take me to the hospital and checked me out thoroughly, but I was completely uninjured. But now I would tell you that as a patient. And would that trigger something in your evaluation? Might you say, well, you may have been uninjured at the time, but, and then
Sure.
what would be the but that you might examine there?
Well, I just have to look at their overall movement patterns. So for example, you may be able to move your neck without pain, but you may be not able to move your neck to the left completely, or more than 50% in some cases. And you're not aware of it because it isn't painful. Until, let's say, you are talking to a friend, and then another friend to your left suddenly starts making a funny joke, and you turn your head to look at her or him, and that's when you notice, whoa, I can't quite do that. I can't do that. In fact, it feels kind of funny. I don't know if it's painful, but it doesn't feel right. And that's when someone gains awareness of, there's something different going on. So when I look at the person, I'm looking at how they move, movement quantity, but also more importantly, movement quality. Is it a smooth, efficient movement, or are they compensating somewhere?
And I'm sure you can see that, something that the patient himself or herself might not even be aware as compensation. But you're looking at it and saying, something's going on here.
Yes, that's the blessing of a holistic integrated approach. It blends in with evaluation and treatments.
I have a coworker of mine, also a friend, who I noticed early on when I started working with him, can't turn his head. He turns his whole body.
Like Dracula.
Yeah, yeah,
Right.
to look. And although I never ask, I look at that and think something went amiss there at some point.
Absolutely.
Some injury, something that causes that kind of
Could be,
motion.
yeah.
Right. So what got you interested in this in the first place? Why did you go into this field altogether?
Absolutely, yeah. So when I was in undergraduate, I was actually in pre-med. And as I got through it, I got more interested in just how people move. And I spent some time at a PT clinic after graduating, and I really enjoyed it. So I decided, hey, this is something that I want to learn more about. So I signed up and went to PT school after that, graduated, and started practicing, decided to get a certification through the University of St. Augustine. It's a manual therapy certification, so it was my introduction to hands-on care. And then just like learning most new things, you're excited about it, and then you learn something that it's great in, and then you learn things that you can't quite fill all the holes. There's some things that are a little amiss. And so I took a variety of continuing education courses over the years until I found something that really delivered better clinical results. And that is my driving force. And I pursued my certification in functional manual therapy. And I finished a residency in it, and it really changed my practice and has made me a better clinician to be able to serve patients in a more fulfilling way.
I think it's really interesting that you talk about movement. And when I think of movement, I have a subscription to the ballet, to Joffrey Ballet here in Chicago, which is all about movement and very
Absolutely.
graceful movement.
Absolutely.
That takes tremendous strength and coordination, but when it's done right, it looks effortless. So when you're studying motion, I mean, do you think sometimes in terms like that, like gracefulness of movement?
Absolutely.
Athletic kind of movement?
It all depends on the patient that you're seeing. For example, if I were to see, let's say, an 83-year-old grandmother, odds are she probably doesn't do ballet now, although there's a potential for that. She would move
And might have as a
differently.
youngster, you never know.
Absolutely, and she probably moves differently now than she did as a youngster when she was 18, practicing ballet every day. So it depends on where we are in a stage of life. It depends on our occupation, depends on our daily habits, like you mentioned earlier. It depends on all those things, including activity levels, perhaps past medical history. So you have to take a complete view of the human being during assessment and during treatment.
Do you ever encounter resistance to that? The reason I ask that, I've interviewed other therapists in various different areas of therapy,
Sure.
and a friend of mine who's a therapist in Cleveland. And they talk about this kind of holistic approach seems to be much more popular now, that people are realizing that being a doctor is not being a body mechanic. There's much
Absolutely.
more to it than that.
Absolutely.
And so occasionally my friend in Cleveland would tell me that there's a little bit of resistance when he's first working with a patient. Like, well, why are you talking about that? And why are you going down that road? That doesn't matter. That's in the past. Do you find that there's kind of resistance to what you do and that you have some sort of overcoming to accomplish this?
Interestingly, no. And here's the reason why. When somebody is in pain, they want to get out of pain. And if I was in pain, I would go to as many people as I could to take care of it. Holistic, traditional, or not. At some point, people go through this process and they realize something's not quite hitting the spot, and they need a more complete view. And so by the time they come to see me, they will have realized that something hasn't been quite addressed. And so when I give them a complete perspective, they are actually excited about things.
And is that typical of patients who come to you, that they've been through some other therapies and they're not quite satisfied, things haven't really been cleared up, so they come to you?
That is the case, although I do also see patients who have never seen a therapist before, and they just happen to come in, and I get a fresh look at them, which is great.
And so they're getting the integrated approach that they didn't realize
Right
wasn't
off the bat.
available elsewhere. Right?
Right, yeah.
One of the things that, as I say, myself having been through physical therapy more than once in my life, I associate it in my own experience with lots of equipment. I had the hand crank to get my shoulder back
Absolutely.
in shape, and the rubber bands and all sorts of different things. And when we were talking earlier before the show, you mentioned that you really don't use a lot of that. It's a much different approach. So how is it, first of all, why don't you need that stuff? and how does it work when you don't have that?
Absolutely. I don't want to make it sound like that stuff isn't needed. It is useful. It's great to build strength. Strength is great as you age. It keeps you functional, keeps you healthy. Being strong and flexible are really important parts of aging. Really important parts of functioning in your daily life. Playing sports, cleaning your yard, shoveling snow. So all those things are part of our daily living, and having strength is a great thing. However, you need a strong foundation on which to build this strength. And so that is something that really interests me, because once you have a strong foundation and you get stronger by doing exercises, using rubber bands, kettlebells, dumbbells, whatever it is you use, you have a better chance of getting stronger without re-injuring yourself or causing some other type of a negative occurrence to happen.
So you just talked about a strong foundation, but if you're not using these traditional strength building tools, how do you build a strong foundation?
Efficient movement is kind of what I look at. So you should be able to move well without, let's say, compensating. You should be able to sit well without compensating. Once you have these efficient movements as part of your daily practice, now you have something reliable to build on, something reliable to add strength onto. It's like a house. You need a good foundation, then you add the fancy stuff on top of it.
Oh, I can see that. Like if you're trying to build strength with an incorrect motion,
Absolutely.
then it's not going to get you where you need to go, and it could
You're
in fact
absolutely right.
injure you further.
It could.
So in your application of therapy, you build this foundation, you get the efficient, I hate to use the word correct, but
Efficient movement.
efficient movement.
Right.
And then if I, for example, if I wanted to build strength, then you would talk to me about what kind of strength exercises I could do on my own.
Absolutely.
Once I've gotten this efficient movement
Absolutely.
nailed down.
When you go to see someone, your goal is not to see them for 2 years. Your goal is to get back to playing with your grandkids, playing sports, doing what you want to do during your life without having to think about, am I going to hurt myself? That's the ultimate goal. And so once this foundation is built, you should have a set of tools to keep yourself healthy and to maybe even address it if it were to resurface in the future.
So do you find that this process, you mentioned getting back to normalcy as quickly as possible, do you find that the approach you take now with functional manual therapy is it more time efficient as well? Do people get that return to normal movement more quickly than through traditional physical therapy?
In some cases, it definitely is. In other cases, where they have a chronic type situation going on, it might take a little bit longer. But there's one thing that a lot of my patients, I'll say most if not all, really love, which is the education component of it. How to sit, how to lift, how to move, and then how to address their body when they feel like something isn't quite right. Let's say they have a little bit of back pain, neck pain. During their course of treatments, they'll be educated on things that they could do to address their own problems and hopefully stay fit in the long term.
So give me an example of what that education would be, like how to sit. I mean,
That's perfect.
You and I are sitting here right now, so
Perfect.
how are we sitting, and are we doing it efficiently?
Exactly. So this is great. I'm glad you asked me this. There's a couple ways to think of it. One is just look at inefficient sitting. So let's say we slouch. So go ahead and slouch with me. You're here. Perfect. And now let's say you try to turn your head left and right. It feels maybe what you're used to. And now if you sit up a little bit to where you're sitting on those sit bones, but now let's make it more interesting. Let's go just ahead of those sit bones. So you're kind of on the front edge. So now I look left and right, and you notice, it seems like it moves maybe a little bit more.
It's actually a wider range of movement.
Exactly.
Yeah.
And now let's exaggerate it even further and sit up really straight and tall, like from the military in the 1940s. And now again, look left and right. And you notice, it doesn't quite feel...
It's a little more constrained.
It is a little bit more constrained. What I just took you through is a little bit of awareness training on where your body functions the best. And now you know that it's that middle section where you're just a little bit ahead of those sit bones, kind of on your pelvic floor, where your neck rotation is more efficient than if you were to slouch back completely or sit overly straight.
That's fascinating.
Yes.
I mean, it's very simple.
It's very simple.
And when I think about education, I think of like lots of retraining or really months or years of trying to teach yourself to do something different, but that wasn't hard at all.
Not at all. And in fact, if you were to see someone because you have back pain, you have extra motivation to relearn things and relearn how to move better and to take care of yourself better.
Now, is sleeping a part of this? I know that particularly with back pain, people talk about the bed they sleep in.
Sure,
And there's all
sure.
sorts of, the sleep number beds are always talking about that. So how important is that element of
Sleeping is undeniably important to just general healing. If you can't get a good night's sleep, your body doesn't have a chance to regenerate. Your body doesn't have a chance to go through a good healing process. So having a good night's sleep is incredibly important.
So does the mattress you're on, does that matter? And if so, what about it makes a difference?
Mattresses do matter. If you're sleeping on a mattress that's 25 years old, odds are you will have to change it.
Yeah.
If it sags in the middle, odds are it's probably not the best mattress for you. For many people, a firmer mattress actually reduces some of their pains that they experience. It could be a matter of pillow positioning. Perhaps you don't use enough pillows under your head, or perhaps you use too many pillows under your head and neck. Maybe it doesn't support your entire neck. Maybe it only supports up to your jaw, and the rest of your neck has this airspace here, which I would tell my patients it has to be filled up. You don't need air spaces here. You need full support. So simple things like that.
So how would you assess that? I mean, if someone comes to you with a series of problems, back problems, neck problems, maybe a combination, and then how would you assess what their home sleeping arrangement is like? I mean, you're probably not going to go pay a visit to their bedroom, so how would you determine that?
I'm actually really happy you asked me that, because sometimes I do go visit patients
really?
in their house and see how they actually do sleep, how they actually do sit at their workstation, how they actually do use a rake in the yard. So that is one thing that I do offer some of my clients, and they happen to love it. Let's say that option's not available. I would have them lie down in the clinic, give them as many pillows as they want, and say, show me how you sleep.
Oh. Simple enough.
Very simple. And then I'll go through a process similar to what I did with you with sitting, take them through different stages and say, hey, do you notice a difference? And usually they notice a difference.
Right away?
Yeah, yeah.
Interesting.
Something's different. Maybe they don't have as much neck pain, or maybe it just feels more comfortable.
Interesting.
That's
So I'm fascinated by the fact that you get that kind of immediate feedback.
It's very important. I think once you learn something and you realize how it impacts your day-to-day living, now you're motivated to make that change. And it really changes how you live your life without fear of causing pain, without fear of moving differently.
Makes me, I would actually be scared to have you over to my house and see my terrible posture at the computer. And
the good news is it'll only take minutes.
Yeah.
To teach you how to move differently, how to sit differently.
How to hold that mouse differently, how to
Right.
not do
Right.
that.
Absolutely.
Actually, I see, when you see Bill Gates on television, and you see Bill, he's always like this, because you know he spent his life
Right,
like
right.
this.
Yeah.
And so you kind of see that as a really residual.
And I have to say, our bodies are amazingly resilient. Some people go through their entire life that way and never notice anything. Others of us sit that way for 10 minutes and they have to move.
Speaking of movement, I've read in some of the popular literature about movement and how important it is, especially if you work at a computer, to get up and move around during the day. Don't sit at the computer for 4 or 5 hours at a stretch. Get up, move around, move your body, and then come back.
Absolutely.
So why is that so important?
Well, our bodies are made to move. We have joints, we have muscles. They're intended for movement. And so also some of us may not be sitting as efficiently as we could, which you're a little bit aware of now. And so once somebody goes through that retraining, they can sit a little bit better, and it should be effortless. You shouldn't work hard at sitting. And once you can get there, you can last a little bit longer. But eventually we do feel like we have to move, and there's nothing wrong with that. There's different ways of sitting that I take some of my clients through, and it makes that process even easier. We're meant to move. We're not meant to be statues. And so there's nothing wrong with getting up, walking around.
This is one thing they tell people who are on long airline flights as well, is don't sit in that seat for 8 hours.
Absolutely.
Get up and move around, walk up and down the aisle.
Definitely. Give yourself a tour of first class, business class.
If they'll let you through the curtain.
Absolutely, yeah.
Right.
Yeah, definitely.
And especially after standing for 4 hours in the TSA line, right?
Yeah,
You get
yeah,
approved. Right?
absolutely. Yeah, and one of the things people occur with sitting for a long time or standing for a long time, maybe something painful. And pain is an alarm system. It basically says, hey, do something a little different.
But what you're doing now is wrong. Now, do you find that some of your patients are either athletes or we mentioned dancers earlier, musicians who have a lot of repetitive movements. Do you find that, and are you able to handle those kinds of situations as well?
Absolutely. Pain doesn't necessarily mean you're doing something wrong. It just means that you need to do it in a slightly different manner. And this might show up even in sports. So maybe they just need to simplify their running technique, make it a little bit more efficient. And sometimes that might reduce their knee pain and they can run faster, run longer. So yeah, it is something that involves movement, involves doing things efficiently, avoiding pain, or resolving whatever pain issues they do have. That all definitely falls under the umbrella of physical therapy.
And I know repetitive motion problems are very common nowadays, especially, again, going back to computers, people
Absolutely.
with a mouse or lots of data entry. So is that something else, like carpal tunnel, which is a common one?
Definitely.
You can all approach all of this stuff, right?
Absolutely. If it has something to do with the musculoskeletal movement, sitting a certain way, lifting something, pushing something, all those things fall under the umbrella of what physical therapy can address.
Are there things physical therapy shouldn't address that sometimes it's asked to address?
Absolutely. So, for instance, if there are clues that something more sinister than just back pain is going on, then you want to be a little cautious and have the patient revisit their physician for further diagnostics. And I think that is something that all physical therapists are very well trained in. And luckily in the state of Illinois, the public can go and visit a physical therapist for initial evaluation without the need of a doctor's script. And then the PT can determine whether or not this is something that they can address, or perhaps there's something a little bit more sinister going on, or maybe there's something else going on that just they want to recheck and make sure that the patient's clear to continue with PT.
For example, I know someone whose husband recently passed away from cancer, but he had complained of back pain, which they initially thought was just pulled something. Well, it turned out to be a tumor.
Yes.
So that's something that you would be able to assess, right, and look at that.
All PDs around the U.S. are well versed in going through and assessing red flags such as these, and it's something that's important, and it's something that every clinician is well trained in performing.
First, do no harm.
First, do no harm. Absolutely.
Right.
Yeah.
So if we only have about a minute or so left, so in that time, for people who are watching the show and are curious about what to do or whether they should come see you or someone like you,
Absolutely.
What would you tell them to think about? How do they approach this right from the get-go?
I'm going to mention a quote that by a doctor in the 50s. His name is Dr. Herman Cabot. So one of the things he said was that all human beings, regardless of their disabilities, have an existing untapped potential. And so whether you have back pain, whether you have hip pain, maybe somebody's gone through a stroke and can't move very well, all of them have some potential to improve.
And so by coming to you, they can try to realize that potential?
Absolutely. Go find a good physical therapist. I'm happy to treat them. Just know the fact that there is room for improvement. That alone is encouraging and can make that change happen.
Well, I can't think of a better way to sum up than that. So, Dr. Boddu, thank you so much for being here. It's been a pleasure. I've learned a lot.
I really enjoyed it. Thank you so much.
And thank you for joining us once again on Public Perspective. I'm your host, Kevin McDermott. You can see us every Saturday night at 8 on Comcast Channel 19 and find us on the web at publicperspective.tv. So, until next time, thank you and good night.